Did you know that 1 in 10 adults in the US has diabetes? With over 38 million people struggling with this condition daily? Even more alarming, more than 96 million Americans are in the pre-diabetic stage without realizing it. According to the Centers for Disease Control and Prevention, CDC, 80% of people with prediabetes are unaware that they are on the verge of developing type 2 diabetes. Diabetes is not just about managing blood sugar, it's a global health crisis. If left unchecked, the consequences can be severe: cardiovascular disease, kidney failure, and more. But the good news is that you can take control of your health. And with a few simple changes, you can manage your blood sugar and even reverse diabetes naturally. So, what is the most effective way to lower blood sugar quickly and sustainably? Let's find out. 1. What can lower blood sugar the fastest? Now that you understand the severity of diabetes and why blood sugar control is crucial, what can actually help lower blood sugar quickly and effectively when it spikes? Insulin. The fastest but not the most sustainable solution. If you need to bring down blood sugar immediately, nothing works faster than insulin. This is the only hormone in the body that moves sugar from the bloodstream into cells for energy. In emergency situations where blood sugar levels exceed 300 to 400 milligrams per deciliter, an insulin injection can rapidly reduce glucose levels within 1 to 2 hours, preventing coma or severe complications. However, insulin is not a long-term solution. Over-reliance on insulin can lead to insulin resistance, meaning the body requires more and more insulin to achieve the same effect. This increases the risk of weight gain, metabolic disorders, and ultimately worsens type 2 diabetes. Optimizing insulin for sustainable blood sugar control. Instead of solely depending on insulin, the best approach is to optimize the body's ability to use insulin efficiently. This means reducing insulin resistance and improving the body's response to natural insulin produced by the pancreas. Some effective methods include intermittent fasting. Helps the body regulate insulin naturally and improves insulin sensitivity. Regular exercise, especially high-intensity interval training, HIIT, and strength training, which help muscles absorb glucose without requiring excessive insulin. Reducing carbohydrates and sugar. Cutting down on refined carbs and sugar stabilizes blood sugar and reduces stress on the pancreas. Incorporating supportive foods. Certain compounds like berberine, apple cider vinegar, and soluble fiber can enhance blood sugar control. In short, while insulin can quickly lower blood sugar, it is not a sustainable solution. Learning how to optimize your body's natural insulin response is the key to long-term diabetes management. So how can you lower blood sugar without insulin? Let's explore in the next section. 2. Why do doctors prescribe insulin immediately? As we've seen, insulin is the fastest way to lower blood sugar. But why do most doctors rush to prescribe insulin the moment a patient is diagnosed with diabetes? Is it truly the only way to manage the disease? Or is there another reason why insulin is the go-to solution? Patients want fast results, but insulin is only a temporary fix. Put yourself in the shoes of someone newly diagnosed with diabetes. Seeing blood sugar levels over 200, 300, or even 400 milligrams per deciliter can be terrifying. Naturally, most people want an immediate solution to bring their blood sugar back to normal as quickly as possible. This is why doctors prescribe insulin right away, because patients expect fast results. There's no denying that insulin can swiftly control blood sugar and reduce the risk of acute complications like diabetic ketoacidosis or hyperglycemic coma. However, the problem is that insulin only manages symptoms, it does not address the root cause of diabetes. If patients rely solely on insulin without making lifestyle changes, they will become increasingly dependent on it, worsening insulin resistance and making the disease harder to manage over time. Diabetes doesn't develop overnight, so why expect an instant cure? A harsh truth that few want to acknowledge: type 2 diabetes doesn't appear overnight. In a week, or even in a month. It is the result of years of insulin resistance, a diet high in sugar and refined carbs, lack of exercise, and chronic stress. Yet, most patients want a quick fix. This creates a paradox. They don't want to change their lifestyle because it requires time and commitment. They want a magic pill that will instantly bring their blood sugar back to normal. And this is precisely why doctors prescribe insulin immediately, to satisfy patient demands for quick results and to lower blood sugar levels rapidly. This approach is not wrong, but if it stops there, without focusing on long-term changes, patients will fall into the trap of insulin dependence, making diabetes even harder to control. The right approach: shifting from quick fixes to sustainable control. Instead of only focusing on short-term results, we need a more comprehensive approach. Reframe expectations. Don't expect instant results. Focus on long-term health improvements. Address the real cause. Type 2 diabetes can be reversed, not through insulin, but through diet, exercise, and stress management. Take gradual steps. Just as diabetes took years to develop, reversing it will also take time. So instead of asking, "How can I lower blood sugar quickly?" we should be asking, "How can I control blood sugar without relying on insulin?" That is the real key to breaking free from the diabetes cycle and reclaiming long-term health. What are the steps to controlling diabetes without insulin? Stay tuned as we uncover the most effective strategies to manage and even reverse diabetes, without the need for insulin dependence. 3. Sustainable blood sugar reduction and diabetes management. As mentioned earlier, doctors prescribe insulin immediately to help patients control blood sugar in the short term. But this is not an optimal long-term solution. Instead of relying on insulin, you can adopt natural methods to manage diabetes sustainably, effective, safe, and without dangerous side effects. So, what are the key changes that can help you stabilize blood sugar without medication? 1. Intermittent fasting. Restoring the body's ability to use insulin. Intermittent fasting, is not a diet but an eating pattern that allows the body to use stored energy efficiently and improve insulin sensitivity. When fasting, insulin production decreases, giving cells time to rest and become more responsive when food is reintroduced. Research shows that intermittent fasting can lower insulin levels by up to 30%, helping to naturally manage diabetes. However, this method requires time for the body to adapt and is not suitable for everyone, especially those taking blood sugar-lowering medications. If you want to try it, start with the 16/8 method, fast for 16 hours. Eat within an 8-hour window, and monitor your body's response. 2. Exercise. Enhancing the body's insulin efficiency. Physical activity plays a crucial role in diabetes management because it helps muscles absorb glucose without needing excessive insulin. This reduces stress on the pancreas and prevents insulin resistance. The best exercises for people with diabetes include brisk walking, 30 minutes per day, helps lower blood sugar immediately. Light weight training, builds muscle and improves glucose utilization. HIIT, high-intensity interval training. Research shows HIIT can increase insulin sensitivity by 58% in just 2 weeks. The key is consistency. You don't need to overexert yourself. Just move daily to support blood sugar control. 3. Stay hydrated, a critical yet overlooked factor. Dehydration can raise blood sugar levels because when the body lacks water, blood becomes more concentrated, leading to higher glucose levels. Additionally, the kidneys work harder to remove excess sugar, which can cause fatigue and electrolyte imbalances. Aim to drink 1.5 to 2 liters of water per day, or more if you are physically active. Stick to plain water and avoid sugary drinks and sodas, which can cause sudden blood sugar spikes. 4. Reduce stress and get enough sleep. 2 major influences on blood sugar. Stress and lack of sleep are often overlooked but directly impact blood sugar levels. When stressed, the body releases cortisol, a hormone that increases insulin resistance and triggers the liver to release glucose into the bloodstream. This explains why many diabetics struggle to control blood sugar despite following a diet and exercise routine. Sleep is just as important. A study found that sleeping less than 6 hours per night can increase insulin resistance by 20%. To improve sleep and reduce stress, practice meditation or deep breathing daily. Limit screen time before bed. Stick to a consistent bedtime routine, aiming for at least 7 to 8 hours of sleep per night. 5. Eat fiber-rich foods, reduce carbs. Control blood sugar naturally. Fiber slows digestion, reducing the speed at which glucose enters the bloodstream, helping maintain stable blood sugar levels. A high-fiber diet can lower the risk of diabetes by up to 35%. Best fiber-rich foods include leafy greens, kale, spinach, cabbage, nuts and whole grains, almonds, flax seeds, oats, legumes, lentils, green beans, red beans. Avoid refined carbohydrates like white bread, white rice, and pasta, as they can cause sudden blood sugar spikes. 6. Apple cider vinegar and lemon, two simple yet effective ingredients. Studies show that apple cider vinegar can reduce post-meal blood sugar by up to 30% by slowing down the digestion of starch. Lemon has a similar effect due to citric acid, which improves insulin sensitivity. Try drinking 1 to 2 tablespoons of apple cider vinegar mixed with water before meals, or adding lemon juice to your meals to support blood sugar control. 7. Berberine and bitter melon, natural blood sugar support. Berberine is a plant compound proven to have effects comparable to metformin, helping lower blood sugar without harmful side effects. Bitter melon also supports glucose regulation effectively. However, consult your doctor before using these supplements, especially if you are taking blood sugar lowering medications, to avoid excessive drops in blood sugar. 8. Simple exercises for diabetics, easy for everyone. If you struggle with high-intensity workouts, try these gentle exercises instead. Seated exercises, leg lifts, arm stretches to improve circulation, light weight training, helps build muscle and support glucose metabolism. Stretching routines enhances flexibility and relaxation. Next steps: lifestyle changes for sustainable diabetes management. In conclusion, managing diabetes isn't just about lowering blood sugar quickly, it's about creating a lifestyle that maintains stable blood sugar in the long run. Small daily changes can lead to significant results, allowing you to reduce dependence on medication and live a healthier life. So, how can you start your natural diabetes management journey? Stay tuned for more insights. 4. The right mindset for managing diabetes. Now that we understand the natural methods for controlling blood sugar, the next crucial step is shifting our mindset about how to handle diabetes. Many people focus only on quick fixes to lower blood sugar, but that's just treating the symptom, not the root cause. To truly manage diabetes, we must address the underlying issues and develop a long-term strategy. Beyond quick blood sugar fixes, prioritizing overall health. Most people, upon discovering high blood sugar levels, immediately look for ways to bring it down as quickly as possible. But did you know that high blood sugar is merely a warning sign, not the actual problem? If you only focus on temporarily lowering blood sugar without addressing the deeper cause, you'll remain trapped in a cycle of dependency on medications, insulin, and worsening complications. Instead, shift your mindset toward a more sustainable strategy. Don't just measure blood sugar, monitor your overall health. Don't just look for ways to lower blood sugar quickly, understand why it rises in the first place. Don't just focus on treatment, take proactive steps to prevent the disease from progressing. Managing blood sugar means managing lifestyle. Lowering blood sugar isn't just about cutting back on sugar. Several factors, sleep, stress, diet, and exercise, all directly impact blood sugar levels. For example, lack of sleep increases insulin resistance, making blood sugar harder to control. Chronic stress triggers cortisol production, causing blood sugar spikes even if you're strict with your diet. A high-carb, low-healthy fat diet causes blood sugar fluctuations, leading to constant fatigue and hunger. Instead of only focusing on blood sugar numbers, view diabetes management holistically, where diet, movement, sleep, and mental well-being all play essential roles. Using technology to understand your body better. One of the most powerful tools for tracking and managing diabetes is continuous glucose monitoring, CGM. CGM doesn't just show your blood sugar at a single moment. It reveals how your body responds to different foods, sleep patterns, and exercise. With CGM, you can identify which foods spike your blood sugar and adjust your diet accordingly. Track daily blood sugar fluctuations to optimize your habits. Understand how stress, sleep, and physical activity impact your blood sugar, allowing for better lifestyle adjustments. 5. Call to action. Take control of your health today. Now that you understand the real nature of diabetes and how to manage it sustainably, it's time to take action today to protect your health. Don't wait until your blood sugar is dangerously high. The best way to control diabetes is to prevent it before it worsens. Be proactive instead of reactive. Most people only start paying attention to diabetes after seeing alarming blood sugar levels. But by then, the body's metabolism has already been damaged for years. Instead of constantly putting out fires with insulin and medication, why not prevent the problem from escalating in the first place? You don't have to wait for complications to develop before making a change. Act now to manage your blood sugar naturally. Avoid medication dependence, and reduce your risk of serious complications like heart disease, kidney failure, and vision loss. Start today. Your health depends on the decisions you make right now.